Good evening and thank you for joining us for 27 tonight. I'm Mona Lisa Tatum. We'll begin now with our big story. Treating arthritis costs billions of dollars every year worldwide, but surgery carried out right here could help see that figure dramatically slashed. While it is still not clear what causes arthritis, a new surgery has been developed to help combat the disease. And as Cayman 27's Andrew Harris finds out, it's history in the making for Cayman.
Martin Graham was a picture of health. He practiced martial arts and cycled to and from work every day. But a training injury brought the 45-year-old to a halt.
I was training very regularly. I would consider myself very fit, but I was constantly running to my physio because I had this particular problem manifested itself as groin and hamstring injuries.
That simple injury would soon turn out to be much more than just groin pains.
And it was discovered that I had quite significant bone spurs and torn labium and significant cartilage damage.
He went to see Dr. Ivan Wong of Cayman Orthopedic Group, who would later recommend a groundbreaking surgery.
Cargel is history-making for many different reasons. Cartilage restoration is one of the last things, or one of the main things that we try to do to prevent arthritis.
Arthritis is estimated to cost tens of billions of dollars in medical treatments around the world. Cargel is a revolutionary surgery that helps to repair damaged cartilage, something that wasn't possible before. But it can't be done everywhere.
The only trouble so far is they have not yet gotten Health Canada approval or FDA approval for North America. That's more of a processing thing that they take time to do. It has already passed the European health boards, so it is approved. It's well documented to be safe and to be effective.
As Cayman falls under British jurisdiction, it's perfectly legal here. During the surgery, bone spurs are trimmed down and damaged tissue is removed.
Usually the bone spur damages the labrum, and then right adjacent to the labrum is the cartilage. And the cartilage usually falls apart, and when it falls apart, when we repair the labrum, there's nothing left in place. So that's where we use Cargel. So after the labrum's in place, now we have a secured, confined space. We can use a small needle and inject this Cargel, which is a thicker substance that we put the patient's own blood in, and fill the blood just like Jello. And so once it's filled, we can close the wound, put the hip back in socket, and bring them to recovery room.
For Dr. Wong, Cargel could be a miracle cure for many sufferers.
Now that we can replace the cartilage, we really have a good shot at decreasing the rate of arthritis in this population.
And a new lease of life for Mr. Graham.
As I said, they could have corrected the bone spurs, they could have corrected the tears, but until Cargel came along, you were stuck with the damaged cartilage because you couldn't repair it. So for me, it's been fantastic.
To date, only 6 people have been treated with Cargel in the whole Caribbean. But Dr. Wong and Mr. Graham believes that number will soon grow. Andrew Harris, Cayman 27.
Experts are still not sure when Cargel will be approved by the FDA and Health Canada. Until then, surgeries will continue to be carried out right here in Cayman.